Omicron's rapid spread is fueling a wave of new COVID-19 hospitalizations in the U.S. According to data from the CDC, an average of 830 children were admitted to a hospital each day over the past week. CBS News correspondent Janet Shamlian reports from Houston, where healthcare workers are dealing with a surge in cases.
Tonight, it's a red flag warning in the Houston area.
This time, it truly is a tsunami when it comes to those cases. It's like nothing we've seen before in this pandemic.
The elevated threat level comes as the nation's pediatric cases are surging. Data just released by the American Academy of Pediatrics shows COVID cases have nearly tripled since the end of December and are now far exceeding the peak of past waves. There are now 580,000 child cases, a 78% increase.
We're used to the unexpected, but the volume is really disappointing. It's exceeded our previous peaks.
And it's spiking across the country. Hospitalizations in general are up almost 40% week over week, pushing healthcare to the brink. About a quarter of hospitals reporting a critical staffing shortage. Beyond healthcare, Omicron is crushing the nation's workforce. One economist says an estimated 5 million may have called out sick last week.
What's happening right now with Omicron is so contagious, where I don't really even want to be open for the employees because we may make each other sick.
And the IRS today warned taxpayers they may have to wait longer for refunds due to pandemic-related delays. The nation's schools are also buckling under the strain. More than 5,000 across the country have gone virtual. Chicago schools canceled classes for a fourth day amid a standoff with the teachers' union over COVID protocols. The community calling for a resolution.
Let's put our children first and make them a priority. This impasse needs to end immediately.
Texas Children's Hospital has a record number of infected kids, more than 75, including 2-year-old Jameston Rogers, who also has leukemia.
It had to be nerve-wracking for you.
Beyond nerve-wracking because he can't tell me what's going on.
Dr. Laura Shakademian is the hospital's chief of critical care.
Are you good though?
She says most of the kids here who are vaccine eligible have not had a shot.
I can tell you with certainty that vaccinated children do not get critically ill from COVID and end up in the ICU.
In light of the serious Omicron surge, Texas Children's Hospital has just announced that it will require all employees to get a booster by March 1st. And CBS News has learned that other hospitals here in the Houston area are considering the same mandate. Lilia?
Janet Shamlian, thank you. Just frightening, those stories with children. Joining us now is Dr. Jeremy Faust. He's an emergency physician at Brigham and Women's Hospital and a professor at Harvard Medical School. Thank you for joining us. Dr. Faust, hospitals across the nation are at a breaking point, trying to handle COVID patients and other patients with other conditions. What are you experiencing on the front lines, and how are you and your staff dealing with this latest surge?
Thank you for having me. I think that here in Boston and around the country, we are seeing a combination of two things at once. All of the usual kind of care that we have, heart attacks and strokes and all kinds of things that actually have a real seasonal component. And we're seeing a lot of that in a way we have not seen in previous waves. And on top of that, you add Omicron, which highlights the unvaccinated and the underboosted. And as a result, we are now seeing across the country, the rate of occupied beds is higher than it's ever been during the pandemic. The rate of ICU occupancy in the country is at times over 81% over the weekend nationwide. Those are staggering numbers. You really start to see trouble mount up in ICUs when things get over 3/4 full. And there are places in this country, I can tell you, where it's more full than that. So we're being squeezed. And I think places all around the country are doing their best to keep up. But in some places, it's getting really tight.
I mean, and throughout the pandemic, people aren't visiting the doctor as much, so conditions could be getting worse if they don't have access to labs, et cetera, or they don't want to go to a hospital, then things could be getting worse. Now, the CDC recently shortened the isolation period for healthcare workers who test positive, but who are asymptomatic. What has been the response from some of your colleagues? What are people saying about this? And is there pressure or too much pressure to return to work, even if you've been infected?
I think these guidelines are very tricky because they reflect the ground conditions. If I had a massive heart attack and the only way I could get to the hospital was an EMS ambulance worker who was just recovering from coronavirus, I suppose I would take the ride. But I would be very glad to see them wearing a lot of PPE, and I would really much prefer to have someone who wasn't infected with coronavirus. But if I go to the hospital because I sprained an ankle and I'm surrounded by coronavirus or people who might still be getting over their infection, that risk may not make sense. So I think the CDC's guidance is unfortunately one size fits all in terms of its edict, but in different situations it could be really important, if dangerous, but a necessary risk. In other places, it's just a terrible idea because you don't really need to do that if you have adequate staffing. So I think what we need to do is to recognize that we're in uncharted waters, try to eliminate spread like that happens when doctors, nurses, and other care workers come to work with the virus. But at the extreme point, I think we all have to acknowledge that at some point, some of these systems don't have a choice. So I think it's a tough spot.
Yeah, and I imagine that leadership in healthcare have to make case-specific decisions. Now, drug makers like Pfizer and Moderna are saying that they're working to develop vaccines that specifically target the Omicron variant, seeing as there's so many breakthrough infections. Is this something that you consider is necessary at this stage of the pandemic, or are the current vaccines that we have enough?
I think it really depends on what you're trying to prevent. We're still learning a little bit. Last week, we got data to show that even a 2-dose series of the Pfizer vaccine was very, very protective against severe disease across a lot of age groups. Older folks clearly are going to need that booster. I think that an Omicron-specific variant booster could be very, very beneficial. I think I'd like to see studies about that. We don't need a lot of data on this. We need some data to show that it makes a difference. My general overall feeling is that the 2- and 3-dose series for those who need it are still holding up really well in terms of outcomes that we're most concerned about. But if we want to decrease infections and we want to take more action, then boosting more people and using variant-specific boosters might be beneficial. So I think it's great that we have the technology that we can do this quickly. Look, if we had a new variant tomorrow that had a new name and a new genetic sequence, and we needed a vaccine to start from scratch, I think that we would be able to look at this within 100 days, they've told us, and I actually think it's feasible. So I like that the technology gives us this flexibility. Let's pursue it and then see if we need it.
And speaking of these variations of the vaccinations, new research out of London suggests that T cells that we get from the common cold may protect us against serious infection of COVID-19. What could this mean for the fight against the virus and how we develop treatments moving forward?
I think that this idea that T cells protect us against severe disease has some credibility. What I think I would say is we all walk around with some immunity from our past experiences. This is one thing that as you get through life, and this is actually an example of what doesn't kill you makes you stronger, because we do have immunity from the viruses that our body has been able to defeat in the past. I look at this differently. I think that everyone has some degree of T-cell immunity to coronaviruses, and thank goodness for that, because if it weren't the case, the fatality and hospitalization rate would be even higher. What I then look at is, well, who doesn't have that immunity? Well, people who are immune compromised. Children, young children, babies, 6-month to 5-year-olds aren't going to be able to be vaccinated for a long time. The very people who aren't going to have a lot of T-cell repertoire, as we call it, T-cell experience from prior infections. They haven't had time. They haven't gotten a zillion colds over 20 years, so that by the time they leave, their homes or college, that their immune systems have a lot of experience. So I think that it's an important piece of information that can help us develop further therapeutics and further vaccinations. But I don't want people to get the idea that if you had a common cold once that felt like that might have been a seasonal coronavirus, that you're somehow protected from COVID-19, which is caused by a particularly bad form of coronavirus.
Yeah, there's a risk in that, especially in these times when a lot of people just read the headline and take that information as they please sometimes. Dr. Jeremy Faust, thank you so much for your guidance.